Hi friends, I am 1 week post-op from my partial knee replacement, and I just wanted to stop by and let you know how my first week went. Surgery was fine. It went well. No complications, no issues with anything. I was using a walker for the first 7 days. And then at physical therapy on my seventh day, they told me I can go to a cane. So my first week was with a walker. And from there on, it will be with a cane. My husband has been taking care of me. He's been my nurse, feeding me, helping me get in and out of bed, get dressed, with the shower, getting in and out of the tub. I have needed assistance with all of that. I do have an elevated toilet seat that we bought, and I do have a shower stool. So those have been super helpful for getting things done. Um, I have had a bit of nausea and vomiting a couple times. I don't know. And now there were a couple days where I forgot to take my normal medications in the morning because I have to take my surgery meds so many times a day. I just forgot to take my morning meds, my normal medication. So I think that my anxiety got away from me, and my anxiety is the reason why I was vomiting, because I just wasn't feeling well. I was really anxious. So as long as I can remember to take my morning meds and my surgery meds, I'll be fine. I only have about a week's worth left of surgery meds, so I will be done with those soon. Uh, we'll see how it's going. At physical therapy, I'm doing pretty good. It is painful. I am saving my narcotic pain medication for physical therapy days. But by the time physical therapy is over, my knee is so loose and it's easier to walk. So the exercises are super important. You really want to do those at home. You want to get up and move a lot, walk a lot. Keep your knee as loose as possible so you don't stiffen up. As far as sleep, I slept a lot during the day and I had a lot of difficulty sleeping at night. Um, so at first, I slept with my leg up on this steep wedge because you need to keep it elevated above your heart and you want to keep it straight as possible to help with your range of motion. So I did that, and it was pretty uncomfortable, hard to sleep. I would sleep maybe 2 or 3 hours, wake up, struggle, wait another hour, take my medication so I could go back to sleep without pain within another hour. It was a process. Um, I'm actually doing really good with my range of motion. I've been pretty good about moving around and stuff. So oh, and ice. Oh my gosh, ice. You need to ice. Get the really big ice pack with the straps that'll like wrap around your knee from Amazon. I think it's 24 inches. And that thing is awesome. It's very, very, very cold. Colder than my other ice pack that I got for my chiropractor for my back. This thing is legit. We also bought an ice machine from Amazon, which I'm going to return because we never used it at all. With those 24-inch ice packs, I didn't need the ice machine. Um, Now, it would have been nice because I really like how the cool from the ice machine just kind of envelops your knee all at once. It feels magical. But the ice pack really does do the trick. You don't really need to spend any more than for the ice pack. Ahead of your pain, that is not a joke. You have to eat snacks a lot. So you're going to need snack food so you can have snacks to take your meds so you don't get an upset stomach if you have a sensitive stomach to pain medication. So overall, the biggest challenge was my nighttime pain and trying to sleep. That was the most difficult part for the first 7 days. Um, My biggest win for the 7 days was that I ended it with authorization to use a cane, which I'm so excited about. So another tip I would say would be to do your research. Before your surgery, I watched so many YouTube videos from physical therapy clinics and orthopedic doctors doing the surgery, talking about the benefits and the challenges to the surgery, talking about the process, the reasons why you need it, the reasons why you maybe shouldn't have it. Um, there's a lot of information out there to be found. So make sure you do your research before you make your decision. This isn't something that you make a snap decision with. This is a major surgery. I had a spinal block and they put a block in my thigh. And then at the end of the surgery, they filled my joint with numbing medicine so that it would help reduce the pain for a longer or an extended period of time. So I ended up having really good pain relief for the first 13, 14 hours after surgery. And then it wore off and the pain really kicked in. So I was really grateful to have the pain meds that my doctor prescribed me. And those meds we weren't able to pick up from the pharmacy until after my surgery. The surgeon's office called in the prescriptions to my pharmacy, so we were able to pick them up on our way home from the surgery center the same day. I didn't stay overnight. It was a same day. We left the house at 6 a.m. and we got home from my surgery right before 6 p.m. So it was about a 12-hour day. Keep that in mind. My husband brought his laptop, his phone, some snacks, and a lunch with him and drinks or whatever to the surgery center. There wasn't a vending machine or anything available. So we were glad we packed him food and snacks and drinks. So keep that in mind for the person who is going to be driving you and taking care of you during your surgery. Well, thank you for checking in on me for my 1 week post-op review. And I will be back next week to let you know how week 2 went. Thank you so much.